calcium. Okay? The degranulation leads to the simultaneous release of your histamine, okay, with the addition of your ATP and other mediators that are stored together in the granules. Another mechanism of release is your chemical and mechanical release. Okay, your morphine, which is an opioid, and your tubocurarine, which is a neuromuscular blockers, which we have discussed previously, they can displace the histamine from its bound form within cells. That's why when you give morphine and tubocurarine during operations, post-operatively, kailangan yung i-monitor yung patient because ang most common complaint of your patients who is given with morphine, nangangati yung ilong. Okay? Papansinin nyo yun. Nagkakaroon din ng mga allergic reactions upon using of these anesthetic medications. The chemical and mechanical release, it does not require energy as compared to your immunologic release. Okay? And it is not associated with muscle injury or explosive degranulations. Another is your compound 48/80, which is selectively releases histamine from tissue muscles by an exocytosic degranulation process, which requires energy and calcium. Okay? The mechanism of action of your histamine, it exerts biologic actions by combining specific receptors located in the cell membranes. And there are 4 histamine receptors. Okay? Your histamine 1, receptors which are found in the smooth muscles, in the endothelium, and in the brain. Your histamine 2 receptors, which are found in the gastric mucosa, the cardiac muscles as well as in the brain. Your histamine 3 receptors, which are found in the presynaptic autoreceptors and heteroreceptors in the brain, in the myenteric plexus, and other neurons. While for your histamine 4 receptors, they are found in your eosinophils, neutrophils, and CD4 T cells. Okay? And what are the effects of histamine in the tissues and organ systems? Okay? So in the nervous system, the histamine are powerful stimulant of sensory nerve endings, especially those mediating pain and itching. Magsasolve ulit tayo?
Yeah.
RT-PCR? Antigen. Niwala ang buto. Masaswab ulit. Okay? So your histamine 1, it causes the urticarial response and reactions to insect and nettle stings. That's why nagkakaroon kayo, nangangati, nagkakaroon ng mga urticaria in cases of insect bites. Okay? Your histamine 1 and your histamine 3 receptors, they are associated with your appetite and satiety. Okay? The antipsychotic drugs that block these receptors causes significant weight gain. Okay? And may mga adverse reactions pag mga antipsychotic drugs because they are associated with your histamine 1 and histamine 3 receptors. Nagkakaroon ng adverse effects like gaining of weight. Okay? Your histamine 3 agonist, it reduces the release of your acetylcholine, the amine, and peptide transmitters in the various areas in the peripheral nerves. Your pitolisant, which is an inverse histamine 3 agonist, which appears to reduce drowsiness in patients with narcolepsy. Okay? So effects of your histamine in the cardiovascular system, the injection or infusion of your histamine will result to the decrease in the systolic and diastolic blood pressure and an increase in your heart rate. Your histamine acts as a vasodilator in the arterioles and in the precapillary sphincters, and the the vasodilation, which is the result of your histamine injection, would result to flushing, a sense of warmth, and a headache. Okay? The vasodilation is caused by your histamine 1 receptor activation, and it is mediated by the release of your nitric oxide from the endothelium. Okay? So the picture is an example, depicts a histamine-induced edema, which the edema is caused by the separation of the endothelial cells, which permits the translation of fluid and molecules into the perivascular tissues. Okay? The presence of your hives or urticaria or the skin lesions, which is in the picture, it signals the release of histamine in the skin. Okay? Effects of your histamine-less smooth muscles, particularly in the bronchial smooth muscles in the lungs. They can result into bronchoconstriction, which is via the histamine 1 receptors. In the gastrointestinal tract smooth muscles, it causes diarrhea because of the contraction of intestinal smooth muscles. And in the uterine smooth muscles, the histamine release would result to anaphylactic reactions, which may result in abortion, which this causes a histamine-induced contraction of the uterine smooth muscles. Well, especially in the first trimester of pregnancy, pag nagkaroon kayo ng mga allergic reactions. Okay? Other effects in the secretory tissues, histamine is a powerful stimulant of your gastric acid secretion, in the secretion of your pepsin, and intrinsic factor production. Okay? Because of the activation of your histamine 2 receptors in the gastroparietal cells. That's why you give histamine 2 receptor blockers for cases like your examples are your ranitidine and cimetidine. Okay? They have effects in the metabolism. The absence of your histamine 3 receptor increases the intake, they decrease the energy expenditure, and may result to obesity. Okay? The insulin resistance and increased blood levels of leptin and insulin is the result of the activation of your in the absence of your histamine 3 receptors. And they can also um, result in a triple response upon the intradermal injection of histamine, which is characteristically the appearance of the red spot, edema, and flare responses in cases of urticarial. Okay? The three separate types would include the smooth muscles in the microcirculation, the capillary or granular endothelium, and sensory nerve endings. Okay? For the toxicity and contraindications of histamine, histamine cannot be given to patients with asthma. Okay? And for their toxicity, they can cause flushing. Upon administration, they can cause immediate hypotension to patients, an increase in the heart rate or tachycardia. The patient would complain of headache, even urticaria, and difficulty of breathing because of bronchoconstriction, and even diarrhea because of the gastrointestinal upset. Okay? These are the histamine antagonists. We have the physiologic antagonists for histamine, would be the epinephrine. Example would be when you have allergic reactions or anaphylactic reactions. When we say anaphylactic reactions, yun yung may hypotension, hypotensive episodes to yung patient, plus type 1 allergic reactions. So ang binibigay doon is yung epinephrine. Okay? Immediate medications for allergic reactions. They have smooth muscle actions that is opposite to those of histamine, okay? That acts on different receptors. We have also drugs that release that inhibit the release of your histamine. We have the cromolyn and nedocromil, which are used. These are drugs used in the treatment of asthma. We have also the beta 2 adrenoceptor agonist, which are also used in asthma as well as in COPD, they reduce the degranulation of your mast cells that results from immunologic triggering by antigen E interaction. So they would block the release of your histamine. We have also histamine receptor antagonists. We have the histamine 3 receptor antagonist, the thiopyramide, and clobenpromide. We have also the selective histamine 2 receptor antagonists, which are used in the therapy for peptic diseases, ranitidine and cimetidine. Okay? Your histamine 1 receptor antagonist, we have two generations. We have the first generation and the second generation. The first generation, yun yung mga diphenhydramine. We have also the loratadine, cetirizine, mga first generations. Hindi. First generations, yun yung diphenhydramine. We have the strong sedative effects. While for the second generation, yun yung mga loratadine, cetirizine, and they have less sedating effects because of the reduced distribution in the central nervous system. And they are commonly used in the treatment of allergic rhinitis and the chronic urticaria. And the pharmacodynamics of these histamine 1 receptor antagonists, they are reversible. They have a reversible competitive binding to your histamine 1 receptors. Pag nagre-review, tapos may mga sinisipon, tapos gusto nyo mag-take ng histamine 1 receptor, you should choose your second generation H1 blockers, which are the cetirizine, loratadine, etc., because they have less sedating effect. Okay, we have also the H1 receptor antagonist actions. They can cause sedation, especially for the histamine 1 antagonist, the first generation. They have an anti-nausea and anti-emetic actions. They prevent motion sickness, like your scopolamine and dimenhydrinate. Pag sa mga clinical application, yung 'di ba anti-vomiting is your metoclopramide. Pwede niyong bigyan ng additional meds like your diphenhydramine or cetirizine yung patient. For pediatric patients, pag nagsusuka, dati kasi parang na namin sa mga updates on pediatric cases, nililesen yung pagbigay ng metoclopramide because it can stimulate seizure reactions to your pediatric patients. So ang binibigay is the first generation antihistamine, which is diphenhydramine. Okay? They have also anti-Parkinsonism effects, especially for diphenhydramine. They have a significant acute suppressant effects on the extrapyramidal symptoms associated with certain antipsychotic drugs. Okay? They have also anti-muscarinic actions, especially for the ethanolamine and ethylene diamine. They have significant atropine-like effects on peripheral muscarinic receptors. When we say atropine-like effects, yun yung mga drying of mouth, tachycardia, aligaga yung pasyente. Okay? They have also histamine 1 receptor antagonists. They have also adrenoceptor blocking action, especially for promethazine. They have alpha receptor blocking effect, which results to orthostatic hypotension. Yung promethazine, siguro mga nurses dito, alam nila they are familiar with promethazine. Yun yung mga dati, mga binibigay ng mga obstetricians if mga patients in labor, tapos complain ng masakit na yung uterine contractions. So sinisedate nila yung patients. They would use promethazine, okay? Pag hindi available yung anesthetist at gusto nilang patulogin yung patient. Okay? They have also serotonin blocking actions, especially your cyproheptadine. They can be also used as a local anesthesia because it blocks the sodium channels in excitable membranes like your diphenhydramine and promethazine. Okay. Your other actions, like the cetirizine, which is the second generation antihistamine, it inhibits the mast cell release of histamine and some other mediators of your inflammation. Okay, so these are the following drugs of the first generation antihistamines. Hindi ko na i-discuss to, parang ano lang yun naman to, parang guide nyo pag nagbigay ng mga first generation antihistamines. It would, yung mga dosage, yung anticholinergic activity, and some of the comments for the first generation antihistamines. Okay? And these are the second generation histamines. We have the piperidine, which is the fexofenadine, with the brand name of Allegra. And we have also the the loratadine, the cetirizine, and the desloratadine. Okay? Now let's go to your histamine 2 antagonist, yung mga ginagamit for peptic ulcers. Okay? And the prototype of which is the cimetidine. We have also ranitidine, famotidine, and nisatidine. Ang familiar lang sa atin is ang common na ginagamit are your cimetidine and ranitidine. Okay? So the histamine 2 antagonists, they do not resemble your histamine 1 blockers structurally, and they are orally active. They have half-lives of 1 to 3 hours. They are relatively non-toxic, and these drugs can be given in large doses. So the duration of action of a single dose may last for 12 to 24 hours. Okay? The mechanism of action of your H2 blockers are, it blocks the H2 receptors, and they are relatively selective. So they don't have selective blocking actions. They don't have actions on your histamine 1 or autonomic receptors. Okay? For the therapeutic effects of your H2 blockers, it causes the reduction of gastric acid secretion. It blocks the cardiovascular and mast cells H2 receptor mediated effects that can be demonstrated, but there's no clinical significance. Okay? So for the clinical uses of your H2 blockers, they reduce symptoms, they accelerate healing and prevent recurrences, especially in acid peptic diseases, in duodenal ulcers. The acute ulcers are usually treated with 2 or more doses per day, while recurrence of the ulcers can often be prevented with a single bedtime dose. Okay? And they are effective in accelerating healing and preventing recurrences of your gastric peptic ulcers. For the Zollinger-Ellison syndrome, you need to have larger doses of your H2 blockers as well as PPIs. And your H2 blockers is also used in the gastroesophageal reflux disease, but they are not as effective as your proton pump inhibitors. Okay? Examples of your proton pump inhibitors are your azole, omeprazole, lansoprazole, etc. Okay? So for the toxicity of your H2 blockers, especially the prototype, which is the cimetidine, cimetidine is a potent inhibitor of your hepatic drug metabolizing enzymes and may also reduce the hepatic blood flow. And they have a significant anti-androgen effects in patients receiving high doses of your cimetidine. Okay? For ranitidine, as compared to your cimetidine, they have no androgenic effects and they have a weaker inhibitory effects on the hepatic drug metabolism. Okay? That's why if you have choices, pag mga sa mga especially pa mga admitted sa ward, tapos nagtitreat kayo ng mga peptic ulcers, common na ginagamit yung ranitidine as compared to your cimetidine because of their toxicities. Okay? Now let's go to your serotonin and related agonists. Serotonin are important neurotransmitters in the central nervous system and in the enteric nervous system. It is actually a local hormone in the gut and it is a component of the platelet clotting process. Okay, they also play a role in the migraine headache, and they are associated with carcinoid syndrome, which is a neoplasm of the enterochromaffin cells. Yung serotonin, naririnig nyo na yan sa previous discussion natin with the mga diniscuss natin last time. Okay? In the brain, serotonergic neurons, they are responsible for the mood. Serotonin are responsible for the mood, sleep, appetite, in the temperature regulation, in the perception of pain, and the regulation of blood pressure, and also for vomiting. Okay, so your serotonin comes from your L-tryptophan, which is it is derived from your L-tryptophan, and the rate limiting step is the hydroxylation by your tryptophan hydroxylase 1. And this can be blocked by your PCPA or your p-chlorophenylalanine and the p-chloroamphetamine. Okay? The telotristat ethyl, which is an orally active hydroxylase inhibitor, it is approved for the treatment of diarrhea due to your carcinoid tumors. And yung serotonin nyo, it will further converted into melatonin, which are found in your pineal gland. Ito yung mga diurnal mga sleep-wake cycles in humans. Okay? For the tissue and organ system effects of your serotonin, in the nervous system, the serotonin are receptors in the gastrointestinal tract and in the vomiting center of the medulla, participating in the vomiting reflex. These are associated with the kaya nagkakaroon ng mga nausea and vomiting for patients undergoing chemotherapy. Okay? They are potent stimulant of pain and itch sensory nerve endings caused by the insects and plant stings, and the activation of your serotonin receptors in the afferent vagal nerve endings causes the basal gyrus reflex. Yung basal gyrus reflex, common siya pag nag-spinal anesthesia pa. Okay? So pagkabigay mo ng ng mga local anesthetics like bupivacaine, nagkakaroon ng basal gyrus reflex, which is characterized by abrupt decrease in your blood pressure and an increase in your heart rate. Okay? Kaya importante na nagbigay na kayo ng anesthetic sa patient, especially the bupivacaine, tinitignan nyo yung monitor. Okay? Para alam nyo yung next na gagawin. Okay? Na-anticipate nyo mga emergency drugs na pang-contradict sa mga nangyayari, like your basal gyrus reflex, available lang siya dapat sa anesthesia table nyo. Okay? In the respiratory systems, serotonin can cause the episodes of bronchoconstriction, especially in the carcinoid syndrome. Okay? And serotonin causes the contraction of vascular smooth muscles, mainly through your serotonin 2 receptors. And serotonin are powerful vasoconstrictor except for the skeletal muscles and the heart because it dilates the blood vessels. Okay? There are also powerful stimulant of the GIT smooth muscles, which results to the increased tone and it facilitates peristalsis. That's when nagkakaroon ng diarrhea sa mga carcinoid syndromes. Okay? Serotonin syndrome. Serotonin syndrome is caused by a combination of your serotonin agonists and monoamine oxidase inhibitors that it is characterized of a skeletal muscle contraction. Okay? Na pwede siyang differential diagnosis with your neuromuscular, with your malignant hyperthermia and neuroleptic malignant syndrome. Okay? Because of the common denominator, which is the skeletal muscle contractions. And this would be the clinical presentation of the three disease entities. Yung serotonin syndrome, ang precipitating drugs would be the second generation antidepressants, the SSRI, and the monoamine oxidase inhibitors. While your neuroleptic malignant syndrome, na-discuss na natin din last time, this can be caused by giving the dopamine 2 blocking antipsychotics like your haloperidol. Okay? Well, for your malignant hyperthermia, which is seen in patients who are prone to the malignant hyperthermia, pag nagbigay kayo ng volatile anesthetics like your sevoflurane, isoflurane, except for nitrous oxide. And also pag nagbigay kayo ng succinylcholine, which is the neuromuscular blocker. Okay? So for the therapy for the different syndrome, pag nagkaroon ng serotonin syndrome, pwede nyong i-sedate yung patient by using your benzodiazepines, intubate the patient pag nagkakaroon ng paralysis, especially for muscles in the respiratory tract. Neuroleptic malignant syndromes can be treated by giving diphenhydramine parenterally or even sedations with benzodiazepines. And the drug of choice for your malignant hyperthermia is the dantrolene. Okay. Now let's go to your serotonin receptors and their effects. Okay. Serotonin 1 receptors, these are most important in the brain and mediate synaptic inhibition by increased potassium conductance. They are peripheral receptors that mediates both the excitatory and inhibitory effects in various smooth muscle tissues. And these receptors are G1 protein coupled. Well, your serotonin 2 receptors, they are important in brain and in the peripheral tissues. They mediate synaptic excitations in the central nervous system and in the smooth muscle contraction, especially in the gut, in the bronchi, in the uterus, and the blood vessels. They also mediate some of the vasodilation, diarrhea, and bronchoconstriction that occurs in the symptoms of carcinoid tumor. Okay? Your serotonin 3 receptors, they are found in the central nervous system, especially in the chemoreceptive area and vomiting center, and in the peripheral sensory and enteric nerves. If you still remember yung tramadol, pag yung tramadol, ang side effect niya is one of the side effects of giving tramadol, yung biglang pag-push mo ng tramadol, nagkakaroon ng vomiting yung patient because of also of your serotonin receptors. Okay? Serotonin 3 receptors, they mediate excitation via the serotonin-gated cation channel, and the antagonists acting at these receptors have proved to be a useful antiemetic drugs. Okay? We have also the serotonin agonists. We have the buspirone, which is a serotonin 1A agonist, and these are effective non-benzodiazepine anxiolytic. We have also the dexphenfluramine, which is a selective serotonin agonist, and it is used as an appetite suppressant, but it is withdrawn because of the side effect, which is the cardiac valvulopathy. Okay? We have also the lorcaserin, which is a serotonin 2C agonist, and it is used in the weight loss medications. Okay? We have, for the serotonin antagonists, we have the pinoxybenzamine, which are drugs used in pheochromocytoma. They are xanthine A adrenoceptors and also serotonin receptor blocking effects. Okay? We have also the cyproheptadine, which is used in the treatment of the smooth muscle manifestations of carcinoid tumor and in cold-induced urticaria. For patients undergoing chemotherapy na laging nagbabamit, ang common na binibigay is the ondansetron, which is a prototype drug, which is a serotonin 3 antagonist. It prevents nausea and vomiting associated with surgery and the cancer chemotherapy. Now for the migraine headache, Pag sinabi nating migraine, headache, um, there is an aura of variable duration, and followed by a severe throbbing unilateral headache lang that lasts for a few hours to 1 to 2 days. And it involves nausea, vomiting, visual scotomas, or even hemianopsia, yung parang half lang yung nakikita mo, and even speech abnormalities. Okay? The trigeminal nerve distribution to intracranial arteries releases calcitonin gene-related peptide, which is a powerful vasodilator that results into your headache, migraine headache. Okay? So that ongoing na yun. So, mamaya na lang ako. Likod. Okay. For the treatment of your migraine headache, you can give sumatriptan, your ergot alkaloids, the non-steroidal anti-inflammatory drugs, the beta blockers, calcium channel blockers, your TCAs, SSRI, and you can also give mga anti-seizure agents. Okay? Um, your triptans, your ergot alkaloids, antidepressant may activate the serotonin 1D or and 1B receptors on the presynaptic trigeminal nerve endings to inhibit the release of the vasodilating peptides. The anti-seizure drugs that is used as a treatment for migraine headache may suppress the excessive firing of the nerve endings, and the vasoconstrictor actions of your direct serotonin agonists, especially the triptans and ergots, they may prevent vasodilation and stretching of the pain endings. Kaya nadidecrease yung migraine headache. Okay? Now let's go to your ergot alkaloids. Ergot alkaloids, these are produced by your Claviceps purpurea, which is a fungus that infects the grasses and grains, especially the rye, under damp growing or storage conditions. And this ergot alkaloid synthesizes histamine, acetylcholine, and theramine. Yung ergotism, which is also known as your St. Anthony's fire, uh, is characterized by the dementia with florid hallucinations, prolonged vasospasm, which may result in gangrene, and stimulation of uterine smooth muscles, which may result in pregnancy, which in pregnancy may result in abortion. Okay? So the organ system effects of your ergot alkaloids, your lysergic acid diethylamide, which is the LSD, or with the street name of acid. These are synthetic ergot compounds, and they have hallucinogenic effects, mga dangerous drugs. We have also the bromocriptine, cabergoline, and pergolide, which suppress the prolactin secretions from the pituitary cells by the activating regulatory dopamine receptors. And bromocriptine can can be given at a dose of 2.5 milligrams twice or thrice a day. And they have a side effect of serious postpartum cardiovascular toxicity. Yung ergotamine, they constrict the blood vessels, which results to prolonged vasospasm, and it is blocked by alpha blocking agents. Okay? Yung ergonobin, common siya na ginagamit pag after the delivery of the baby and placenta, tapos nagkakaroon pa rin ng continuous bleeding of the uterus. Ito na yung binibigay, yung ergonobin. Okay? For uterine contraction, para mag-contract yung uterus, mag-stop yung bleeding. It is also used in postpartum hemorrhage. The first choice for postpartum hemorrhage is oxytocin. But sometimes kahit nakadalawang oxytocin ka na sa pasyente, after the delivery of your baby, nagkakaroon pa rin ng continuous bleeding. And the next choice of drug that you can give is the ergonobin. Okay? It is given intramuscularly at 0.2 milligrams dose, and it is effective within 5 minutes. Okay? So it is given at the time of delivery of the placenta, or immediately afterward if the uterine bleeding is significant. So other uses of your ergot alkaloids, so they can be used as a treatment for migraine. They are highly specific for migraine pain because it can induce vasoconstriction. Okay? No more than 6 milligrams of the oral preparation may be taken for each attack and no more than 10 milligrams per week. Uh, for, for very severe attacks of migraine, you can give ergotamine type tartrate at 0.25 to zero point 0.5 milligrams either intramuscularly or intravenously. For intractable migraine, you can give dihydroergotamine at zero point 0.5 to zero point 0.1 milligrams IV, or there's also a preparation intranasally. Okay? We have also the methysergide, which is a prophylaxis for migraine, but it has toxic effects and hindi masyadong ginagamit. Okay? Other uses of your ergot alkaloids, they are used in the diagnosis of variant angina. Okay? Especially for imaging processes in the diagnosis of angina, yung hinahanap kung saan part ng artery na block. So because your ergot alkaloids produces a prompt vasoconstriction during coronary angiography. Okay? They are also used for the relief of signs of senile cerebral insufficiency and in the treatment of Alzheimer's dementia. Okay? Now let's go to your vasoactive peptides. The vasoactive peptides, at ito yung ano na dinidiscuss nyo sa renin-angiotensin aldosterone system. Okay? So the angiotensin 1, which comes from your angiotensinogen via the release of your renin. The renin is controlled by macula densa, and it results from, it has an inverse relationship between your sodium chloride concentration. Your angiotensin 1, which is biologically inactive, will be further converted to your angiotensin 2, which is the active compound by your converting enzymes. Okay? And then your angiotensin 2 will be promptly degraded by your into peptide fragments by your angiotensinases. Okay? Um, binibigay nyo gamot for antihypertensives, the ACE inhibitors, the angiotensin converting enzymes, renin blockers. We will discuss that one more. Okay? The vasoactive peptides, the release of your renin will be stimulated by giving vasodilators like your hydralazine. Hydralazine is antihypertensive drugs that is safe for pregnant patients. The release can be also stimulated by giving minoxidil, mga hair growers, and even nitroprosides. Okay? The release of your renin is also stimulated by your beta adrenoceptor agonists, your alpha antagonists, and even the phosphodiester inhibitors like your theophylline, melvinone, and nulipram. Okay? Renin is also released by giving diuretics to your patients, and even anesthetic drugs may stimulate the release of your renin. Okay? For the production of angiotensinogen, it is increased by giving corticosteroids, mga estrogens, thyroid hormones, and it is also elevated during pregnancy. Kaya nagkakaroon ng mga pre-eclampsia, nagkakaroon ng episodes of BP elevation because of during pregnancy because of your production of your angiotensinogen. And also increase in cases of oral contraceptives administrations, and all of this would result to hypertension. Okay? The actions of your angiotensin 2 They can increase the blood pressure because they are potent pressure agent. They have a direct contraction of vascular, especially the arteriolar smooth muscles. But there's no reflex bradycardia because it acts on the brain to reset the baroreceptor reflex control of the heart rate to a higher pressure. It also increases the release of your epinephrine and the norepinephrine, and they have a direct positive inotropic actions on the heart. Okay? So the inhibitions of your renin-angiotensin system, we have the ACE inhibitors, which inhibits the conversion of your inactive angiotensin 1 to active angiotensin 2. It blocks also the release of your renin. Okay? But the most common adverse effects of your ACE inhibitors would be cough. Na-stimulate yung cough ng pasyente. Kaya pag nagbibigay kayo ng antihypertensives, tapos may mga comorbidities like asthmatic yung pasyente, COPD yung pasyente, uh, don't give ACE inhibitors as antihypertensive for these patients. We have also the ARBs or the angiotensin receptor blockers, mga sartan, losartan, valsartan. It blocks the angiotensin receptors. These sartan are used especially for diabetic nephropathy. Pag mga 20 years nang may diabetes na uncontrolled, tapos may mga manifestations na like yung increase ng BUN-CREA, that would result to diabetic nephropathy. Ang best na binibigay nyo sa hypertensive patients is losartan and valsartan. But not be used by patients with non-diabetic renal disease or in pregnant patients. Okay? We have also the beta blockers, the olol naman yung mga ano niya. Okay? We have the propanolol, metoprolol. It blocks the renal beta receptors that are involved in the sympathetic control of the release of renin. We have also the aliskiren, which is also contraindicated in pregnancy. They can cause dose-dependent reductions in the plasma renin activity and plasma angiotensin 1 and angiotensin 2 aldosterone contractions. Okay. We have also the kinins, which causes a marked arteriolar dilatation in several vascular beds, especially in the heart, in the skeletal muscles, in the kidneys, liver, and intestine. They causes the release of nitric oxide or vasodilator prostaglandin such as your prostaglandin 2 and prostaglandin I2. Okay? They have a predominant effect. The predominant effects of your kinins on the vein is contraction. Okay? When kinins are given intravenously, they cause a rapid but brief fall in the blood pressure that is due to their arteriolar vasodilator actions. Your bradykinin, this bradykinin produces the 4 classic symptoms of inflammation, which are redness, local heat, swelling, and pain. Yung mga hypotensive patients, kailangan yung bigyan, mga hypotension secondary to sepsis, mga septic patients, especially in the ICU, ang binibigay is vasopressin. Okay? We have the arginine vasopressin and the antidiuretic hormones. The control of blood pressure through its action in the kidneys, which is the increased watery absorption. It is the regulation of arterial pressure by its vasoconstrictor actions. And there are 3 subtypes of your vasopressin receptors. We have the vasopressin 1A receptors, which mediates the vasoconstrictor actions in the atrial vasopressin. We have also the B1B receptors, which mediates the release of the ACTH by the pituitary corticotropes. And we have also V2 receptors, which mediates the antidiuretic actions. Okay? So your ABP analogs selective for vasoconstrictor or antidiuretic activity. We have the vasotocin, which is the first specific for your vasopressin 1 vasoconstrictor agonist. The vasopressin or saliprazine, these are short-acting selective V1A receptor agonists. And we have also the D-aminoargine vasopressin and the D-aminovaline arginine vasopressin, which are selective V2 antidiuretic analogs. So the combination of your vasopressin and norepinephrine, these are beneficial in the treatment of septic shocks and other vasodilatory shock states like the V1A agonist activity. Okay, your vasopressin analogs, they are selective for vasoconstrictor or antidiuretic activity. We have the vasotocin, which is first specific B1 vasoconstrictor agonist. We have also the, tapos na pala natin. Okay? Now let's go to your natriuretic peptides. We have the atrial natriuretic peptides, your ANP, which is synthesized primarily in the cardiac atrial cells, but it also synthesized in the ventricular myocardiums and neurons in the central nervous system and in the peripheral nervous system and in the lungs. And it is released by atrial stretch via the mechanosensitive ion channels due to volume expansion, and they are also released through changing from the standing to supine positions, mga orthostatic positions. They are also released as a result of the exercise and sympathetic stimulation by the alpha-1A adrenoceptors. Your brain natriuretic peptides or your BNP, they are synthesized primarily in the heart, especially in the left ventricle, and it is volume related. Your C-type natriuretic peptide, CNP, these are found in the CNS, vascular endothelium, in the kidneys, and even in the intestine. And the clinical roles of your natriuretic peptides, they can be administered as carperitide, which is a recombinant ENP. We have also nesiritide, which is a recombinant brain natriuretic, and we have also the ularitide, which is a synthetic form of urodilactin. Okay, these natriuretic peptides are used in the treatment of congestive heart failures because of the vasodilation and the natriuresis effect. Okay. Your the VIPs or the vasoactive intestinal peptides, they are widely distributed in the CNS and in the peripheral nervous system. They are the major peptide neurotransmitters, and it causes a marked vasodilation in most vascular beds, and they can cause coronary vasodilations and exerts its positive inotropic and chronotropic effects. Mga common na ginagamit sa mga ICU settings ito. Pag mga hypotensive episodes na kaya nakikita niyo sa ICU, ang dami-daming mga swero. Ang tawag doon, Christmas tree. Kasi sobrang daming swero na binibigay sa pasyente. And this contains the mga pampataas ng BP, para mga pampakontract ng myocardium para magkakaroon ng blood supply to different parts and to increase the blood pressure of your patients. It also used in the treatment of systemic and pulmonary hypertensions and in heart failure. Your substance P, it is widely distributed in the central nervous system and in the peripheral nervous system and in the cardiovascular, in the CNS and the PNS. And they are also present in the gastrointestinal tract. They act as a transmitter in the enteric nervous system, and they also act as a local hormone in substance P. Okay? They causes the contraction of your venous, intestinal, and bronchial smooth muscles. And They stimulate secretion by the salivary glands and causes diuresis and natriuresis by the kidneys. Your aprepitant, which is an substance P antagonist, is used in the prevention of nausea and vomiting, especially for patients undergoing chemotherapy or even post-operative nausea and vomiting. Okay? We have also the neurotensin. Uh, when neurotensin is administered centrally, they have potent effects including hypothermia, anti-nociception, and modulation of your dopamine and glutamate neurotransmissions. But in peripheral circulation, your neurotensin causes vasodilation, hypotension, tachycardia, um, etc. Okay? Your calcitonin gene-related peptides, which includes your calcitonin, adrenomedulin, and amylin, um, the effect of your calcitonin gene-related peptides in the central nervous system can cause hypertension and suppression of bleeding. And in the systemic circulation, your CGRP may cause hypotension and tachycardia, and they are most potent vasodilators. Yan. Parang yung naalala ko sa sa board exam namin, which among the following is the most potent vasodilator, and the answer would be the calcitonin gene related peptides. And sa hindi pharmacology yung exam namin. Okay, we have also the adrenomedulin, which the highest concentrations are found in the adrenal glands, in the hypothalamus and the anterior pituitary, and they dilate resistance vessels in the kidneys, in the brain, in the lung, in the mesentery, resulting in a marked long-lasting hypotensions. And the adrenomedulin in the kidneys, they increase sodium excretion and renin release. And it exerts other endocrine effects, including your inhibition of your aldosterone and insulin secretion. Tapos na lahat.
Yan ang mga taga-admin. Ito na lahat sa harap.
E paano yung mga walang doctors?
Sa duty na lang sa ulo nila.
In the central nervous system, the adrenomedulin increases sympathetic outflow, and these are increased during intense exercise, in pulmonary hypertension, in acute myocardial infarctions, and cardiac and renal failure. Okay? We have also the neuropeptide Y. We have the pancreatic polypeptide. We have the peptide YY and the neuropeptide Y. Okay? Your pancreatic polypeptide, which is secreted by the islets of Langerhans after food ingestion in the proportion of the caloric content. In the brainstem and in the vag and the vagus, your PP promote appetite suppression. They inhibit gastric emptying and increase energy expenditure. And they have direct actions in the gut. Okay, your peptide YY, it is released by your enteroendocrine L cells of the distal gut in proportion to food intake and produces anorexigenic effects. Your neuropeptide Y, which acts as a neurotransmitter, they are vasoconstrictor and as a co-transmitter with your norepinephrine. They are potent renal vasoconstrictor and suppresses the renin secretion, but can causes diuresis and natriuresis. Okay. Now let's go to your urotensin, which is a potent constrictor of your vascular smooth muscles. Your plasma urotensin 2 levels increases in hypertension, heart failure, atherosclerosis, in the DM, and in renal failure. Okay? Pag sinabing urantide, it is also known as your urotensin antagonist peptide. Okay? Your palosuran, which is an oral active non-peptide antagonist of the urotensin 2 receptors, they have a beneficial effects in the patients with renal failure, but not in hypertensive patients with type 2 diabetic nephropathy. Okay, so for the summary of drugs that interact with your vasoactive peptide systems, We have the valsartan, the sartan group of drugs, which are the angiotensin receptor antagonists. The mechanism of action of your sartans are they are selective competitive antagonists of your angiotensin 1 receptors. And these are used in hypertensions. Okay? Your angiotensin receptor agonists, which are used in the treatment of cardiovascular diseases. Example of which is the compound 21, which is the 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 act in 80 receptor agonism. Okay, we have also the converting enzyme inhibitors, mga ACE inhibitors, like we have the enalapril, captopril, mga and other drugs. It inhibits the conversion of your angiotensin 1 to angiotensin 2. Okay? And these drugs are used in the treatment of hypertension and heart failure. We have also the renin inhibitor, which is the aliskiren. Um, these are also used in hypertension. And the mechanism of action is the inhibition of the catalytic activity of your renin. Okay? We have also the kinase inhibitors. We have the icatibant, the ecallantide, the plasma kallikrein inhibitors. And these drugs have the mechanism of action of antagonists of your kinin B2 receptors. And these are used in hereditary angioedema. We have also the vasopressin agonists, the arginine vasopressin or the celepressin. Okay? Um, they are used in the vasodilatory shocks. You have also the vasopressin antagonists. We have the conivaptan, the tolvaptan, and they have a potential use in the hypertension and heart failure, especially for high natremic patients. And we have also the natriuretic peptides, like we have the neseritide, ularitide. These are drugs used in heart failure. Okay? The mechanism of action of which they are agonists of the natriuretic peptide receptors. Okay? We have also the combined angiotensin converting and mga ACE inhibitors, omapatrilat and sumatratilat. They are used as anti-hypertensive drugs. We have also the combined angiotensin receptor antagonists and the neprilysin inhibitors. Hindi na siya common na ginagamit. Okay? Wala pa akong nakita na ganun. Okay? We have also, ito, hindi pa common na ginagamit sa setting natin. Okay? Mga common na ginagamit natin is mga ito. And the natriuretic peptides and vasopressin agonists. Now let's go to the eicosanoids, the prostaglandin, thromboxans, leukotrienes, and related compounds. Okay? So your prostanoids, which includes your prostaglandin, prostacyclin, and the thromboxans, um, they are originated from the arachidonic. They are originated in the membrane phospholipids, and through the action of your phospholipase A2, they are converted to arachidonic acid. And there are two important pathways for arachidonic acid. We have the lipooxygenases pathway, which are important in asthma, like the leukotrienes, lipoxins, and we have also the cyclooxygenases pathway or the COX pathway, which results in the formation of your thromboxan, prostacyclin, and the prostaglandin. Okay, and the two unique COX isoenzymes that converts arachidonic acid into prostaglandin and peroxides are your COX-1 and your COX-2. Okay, your COX-1 or your prostaglandin synthesis is one. These are expressed constitutively in most of the cells. Okay, it generates prostanoids for housekeeping functions such as your gastric epithelial cytoprotection. We have also the COX-2, which are the major source of the prostanoids. They are readily inducible, its expression levels being dependent on the stimulus. Okay. We have also the non-steroidal anti-inflammatory drugs. I think na-discuss nyo na mga to sa previous lesson kay Dr. Pasqua, Dr. Eileen. The NSAIDs or the non-steroidal anti-inflammatory drugs, they exert their therapeutic effects through the inhibition of your cyclooxygenase. We have also the endomethacin, the sulindac, meclofenamate, and the ibuprofen. These are non-selectively inhibit both the cyclooxygenase 1 and the COX-2. Okay? The selective COX-2 inhibitors, we have celecoxib, diclofenac, meloxicam, etodolac, valdecoxib, rofecoxib, lomiracoxib, and etoricoxib, and these are arranged in an increasing COX-2 selectivity. Okay? We have also the aspirin, which acetylates and inhibits both enzymes covalently and hence irreversible. Okay? So these are the products of the arachidonate series. We have the prostaglandin 1, E1, which is the alprostadil. They are used for its smooth muscle relaxing effects to maintain the ductus arteriosus patent in some neonates awaiting cardiac surgery in the treatment of, they're also used in the treatment of impotence. Okay? Sa ano namin nun, sa during clerkship, may mga pinapanganak na premature na with patent ductus arteriosus. Ang palaging tinatanong sa amin mga to, mga residents ng PEDIA. Mga mechanism of actions ng alprostadil, mga na-clinoclose, yung pag-open ng patent ductus arteriosus para hindi magkaroon ng problema during parang inaantay mo na i-close ng surgery. Okay? Yung mga patent ductus arteriosus. Yun yung mga mga tinatanong sa amin. I remember when sa clerkship namin sa SLB. Okay? We have also the mesoprostol, which is a prostaglandin E1 derivative. Itong mga cytotec, mga common name niya. These are cytoprotective prostaglandin used in preventing peptic ulcer and in the combination of mifepristone for terminating early pregnancies. Mga nagpapa-abort, mga misoprostol ang ginagamit. Okay? Pero kailangan prescription from the obstetricians and gynecologists. Okay? We have also the dinoprostone, which is the prostaglandin E2 and the prostaglandin F2 alpha, which are used in obstetrics and to induce labor. Okay? We have also the latanoprost, which are topically active prostaglandin F2 alpha derivatives that is used in the ophthalmology to reduce the intraocular pressure and in open angle glaucoma or the ocular hypertension. Okay? We have also the prostacyclin or the PGI2, which are synthesized mainly in the vascular endothelium, and it is a powerful vasodilator and inhibitor of your platelet aggregation. Okay? We have also the epoprostenol, the eloprost, the treprostinil, which is these are used to treat pulmonary hypertension. Okay? For the inhibition of your eicosanoid synthesis, we have the corticosteroids, which blocks all the known pathways for eicosanoid synthesis. They inhibit the phospholipase A2 activity. We have also the NSAIDs. They block both the prostaglandin and thromboxane formation by reversibly inhibiting the COX activity. As compared to your aspirin, they are irreversible COX inhibitors. Okay? We have also the lipooxygenase inhibitors, the Xileuton, the Saperlucas, Montelukast, and the Pranlucas. They are drugs. These are used to treat asthmatic patients, the mild to moderate asthma. Okay? For the clinical pharmacology of your eicosanoids, we have the dinoprostone, which is a preparation of your prostaglandin E2. They are administered vaginally for oxytocin use. They are used in the induction of labor or in the softening of the cervix. Yung mga prolonged labor, tapos pag inaitin yung pasyente, masyado pang makapal yung cervix. So binibigyan mo intravaginally ng dinoprostone para ma-soften yung cervix ng pasyente. Okay? So at 20 milligrams dinoprostone vaginal suppository can be given repeatedly at 3 to 5 hours intervals depending on the response of the uterus. Okay? We have also the antiprogestins, which is the mifepristone, in combination with your misoprostol. This combined drug is used in the early abortion. Pag ginagamit siya intravaginally in cases of sepsis, and the side effects would be the cramping, pain, and diarrhea. Okay? We have also the carbopros, ayan, mga common na ginagamit, mga nakastock sa delivery room. These are the analogs. Carbopros is an analog of prostaglandin F2 alpha 8. Okay? They are used in the induced second trimester abortions and to control the postpartum hemorrhage. Yung mga pag hindi nag-work yung oxytocin, pag hindi nag-work yung methergine, pwede kang magbigay ng carbopros pag continuous bleeding din yung uterus mo after NSD. Okay? But your carbopros cannot be given to patients who are asthmatic because it can cause bronchoconstriction, and even patients na septic, na nagkakaroon ng uterine bleeding tapos septic yung patient na may mga temperature elevations or sobrang taas ng mga temperatures niya, it is contraindicated to give carbopros. Okay? Your eicosanoids can also be used in cases of dysmenorrhea. In dysmenorrhea, there is an increase in the prostaglandin E2 and prostaglandin F2 alpha during the menstruation. That's why you can give NSAIDs, which inhibits the formation of your prostaglandin. Okay? The alprostadil, which is the prostaglandin E1, these are used in the treatment of erectile dysfunction. Okay? So you can give it in intracavernosal injection at 2.5 to 25 micrograms. These are also administered by a transurethral suppository by using the 125 micrograms or the 250 micrograms or up to 1,000 micrograms, and it can result in the prolonged erection and priapism. Okay? We have also the epoprostinol or the prostaglandin 1,2, which is in the treatment of pulmonary hypertension. It lowers the peripheral, pulmonary, and coronary vascular resistance. We have also the elopros, the treprostinil, the selexipag, and the treprostinil. These are prostacyclin analogs with longer half-lives. Okay? The thromboxane or thromboxane A2, the application of which is to promote the platelet aggregation, and the prostaglandin I2, prostaglandin E2, and the prostaglandin D2, they inhibit the platelet aggregation. Okay? For the clinical application of your aspirin, these are used in cases of mga myocardial infarctions, mga cardiovascular events. So in cases sa clerkship nyo, or even sa private practice, pag nagpa-practice na kayo, pag may mga complaints, especially mga 50 years old pataas, tas ang complaint is epigastric pain or even shoulder pain, tapos may konting hirap na paghinga, mag-ECG mo agad yung pasyente at magbigay ka na ng 4 tabs of aspirin na ichuchu ng patient. Para ma-treat mo. Kasi most likely, mga myocardial infarction yung mga to. And the drug of choice for the myocardial infarction is aspirin. They are selectively and irreversibly inhibit the platelet FOX1 and its dominant product, which is the thromboxane A2. Okay? So these are used in cardiovascular events. Okay. Now let's go to your nitric oxide. Nitric oxide, iba yung nitrous oxide, which are nitrous oxide na ginagamit sa OR. Iba din yung nitrogen dioxide, which is a toxic pulmonary irritant gas. The mechanism of action of your nitric oxide, it activates soluble guanylyl cyclase to elevate the CGMP levels in the vascular smooth muscles. And the effect of your nitric oxide would be the vasodilation. It relaxes the smooth muscles, and the inhalation of your nitric oxide leads to increased blood flow to parts of the lungs exposed to nitric oxide and decreased pulmonary vascular resistance. Mga nitric oxide, ginagamit siya in the treatment of pulmonary hypertension, especially for premature babies. We have the nitric oxide donors. We have the organic nitrates, which is the nitroglycerin. They dilate veins and coronary arteries. They are metabolized to nitric oxide by mitochondrial aldehyde reductase, which is an enzyme enriched in the venous smooth muscles, accounting for the potent venodilating activity. And they are used as an antigen. They are used as an anti-angina because of uh, venous dilation that decreases cardiac preload and coronary artery dilation. Ay yung mga isosorbide dinitrate, mga sublingual na nilalagay nyo in cases of myocardial infarctions or mga isosorbide dinitrate. Mga isordil yung mga nilalagay nyo sa ilalim ng dila. Okay? We have also the organic nitrites, the amyl nitrate, which is an anti-anginal inhalant. It causes arterial arterial vasodilator, and the side effect is euphoric effects. In yung combination of your amyl nitrite plus sildenafil can cause lethal hypotension. That's why pag pag nag-prescribe kayo ng sildenafil, sildenafil, the common name is by one of the brand names of sildenafil is Viagra. Okay? May case kami dito dati, employee na siya doon. Tapos namatay dun sa kasi nag-take siya ng sildenafil, Viagra, pero nagtitake din siya kasi ng mga anti-anginal drugs niya. And ayun, causes lethal hypotension resulting to death. Okay? We have also the sodium nitroprusside, which dilates arterioles and venules for the rapid pressure reductance, especially in arterial hypertension. Okay? So the nitric oxide gas inhalation, ito yung mga ginagamit sa pediatric ICU in cases ng mga patent ductus arteriosus or the pulmonary hypertensive patients. They reduce pulmonary artery pressure and improve perfusion of ventilated areas of the lungs. So they are used in the pulmonary hypertension, acute hypoxemia, and cardiopulmonary resuscitations. Let's go to the drugs used in asthma. Gutom na ba kayo or tuloy-tuloy na natin? Okay, so the pathogenesis of your asthma, it is mediated by the immune globulin E. It is produced in response to exposure of foreign proteins such as your house dust mite, cockroach, animal danders, molds, and pollens. Your immunoglobulin E binds to high affinity receptors on mast cells in the airway mucosa. And the re-exposure to allergen triggers the release of mediators that are stored in the mast cell granules and in the synthesis and the release of other mediators. Okay? So in the early asthmatic response, we have the histamine, tryptase, leukotrienes, the C4 and D4, the prostaglandin D2, um, that is released and causes the smooth muscle contraction and vascular leakage that is responsible for the acute bronchoconstriction. But in the late asthmatic response, there is a sustained phase of bronchoconstriction. Okay? So there's an influx of inflammatory cells in the bronchial mucosa, and with an increase in the bronchial reactivity. That's why nagkakaroon ng bronchoconstriction. Yung bronchial opening nalilesen. Kaya hirap huminga yung mga asthmatic patients. And due to cytokines, they characteristically produced by the T lymphocytes, especially the interleukins 5, 9, and 13. Okay? So in the release of your cytokines, it attracts and activates eosinophils. It stimulates the immunoglobulin A production by your B lymphocytes. It also stimulates the mucus production by bronchial epithelium. And the treatment would be the corticosteroid therapy because it inhibits the production of your pro-inflammatory cytokines in the airways. Sa mga asthmatic patients, pwede kayo magbigay ng hydrocortisone or dexamethasone, pero mostly na ginagamit is yung hydrocortisone as a corticosteroid therapy to inhibit the production of your pro-inflammatory cytokines. Okay, so the basic for the basic pharmacology of agents used in the treatment of asthma, we have the sympathomimetic agents. We have the adrenoceptor agonists, which are the mainstay in the treatment of asthma. Okay, the binding to the beta-adrenergic receptors will resort to the stimulation of the adenylyl cyclase and the formation of your intracellular camp. And this would result to the relaxation of your airway smooth muscles and inhibition and the release of the bronchoconstricting mediators from your muscles. Okay? It also inhibits the microvascular leakage and increased mucociliary transport. But the adverse effects in giving your adrenoceptor agonist, it can cause tachycardia, skeletal muscle tremor, and the decrease in the serum potassium levels. That's why pag nagra-rounds kayo sa wards, yung mga patients na nakasalbutamol, mga naka-terbutaline, isoproterenol, ang common complaint nila during pag-take ng mga ganitong gamot, parang nagtitremor sila, nagagana. Tapos pag nagpapalpitate din yung mga pasyente, and you should always check, especially pag naka 3 days ka na ng mga inhalants, i-check mo yung potassium level of the patient. Okay? We have also in the treatment of asthma, we have the epinephrine, which is injected subcutaneously or inhaled as a microaerosol from a pressurized canister. Pwede nyo ring as pwede nyo ring inebulize yung epinephrine, the racemic mixture of epinephrine. So magbigay ka ng 0.1 ng epinephrine plus lalagyan mo ng sterile water. Tapos pwede mong ipa-inhale or pa-nebulize sa asthmatic patients. And this would result into bronchodilation, which is achieved within 15 minutes after inhalation, and will last for 60 minutes to 90 minutes. Okay? Your epinephrine stimulates your alpha, B1, B2 receptors that would result in tachycardia, arrhythmias, and the worsening of angina pectoris. Okay? That's why ang common complaint ng patients na nebulize nyo ng epinephrine or na-injectan nyo ng epinephrine is tachycardia. Sobrang bilis ang pagtibok ng puso. Okay? We have also the isoproterenol, which is a non-selective B1 and B2 bronchodilator. When inhaled at 80 to 120 micrograms, it causes a maximal bronchodilation within 5 minutes and has a 60 to 90 minutes duration of action. But the common adverse effects of giving of isoproterenol, it causes cardiac arrhythmias. Okay? We have also the beta-2 selective drugs. We have the albuterol, terbutaline, metoprolol, and the perbuterol. These are used as a metered dose inhalers. Mga puff ay mga mga discus, serotype discus, mga ganun. Yun yung mga ini-inhale, especially asthmatic patients and even COPD patients. We have also the albuterol and terbutaline, which is available in oral form. The adverse effects is the skeletal muscle tremors, nervousness of patients, and occasional weakness because of the decreased potassium level. Okay? They have more pronounced adverse effects, kaya hindi masyadong ginagamit yung albuterol and terbutaline. Okay? Yung terbutaline can be given in subcutaneous injection at 0.25 milligrams dose, and sometimes used to inhibit the uterine contractions associated with premature labor. That's why pag may mga pumupunta na pasyente na nagkakaroon ng mga pregnant patients na premature labor, minibigyan ng terbutaline ng mga OB to decrease the uterine contractions, to prolong the weeks of age of gestation of your patient. We have also the LABA, or the long-acting beta-2 selective agonists. They have no inflammatory actions. They cannot be used as a monotherapy for asthma. And example of which are the salmeterol and formoterol. Okay? They have a longer duration of action because of their high lipid solubility. Okay? We have also the ultra long-acting beta agonists. Example of which are your bambuterol, bilanterol, olodaterol, and the eldacaterol. Okay? For the toxicities of your beta-2 selective drugs, they can decrease the arterial oxygen tension, or the PaO2, and the treatment would be ibigyan mo lang ng supplemental oxygen ng patient. They can cause also cardiac arrhythmias and even tachyphylaxis, tachycardia. Okay? Now let's go to your methylxanthine drugs. We have the theophylline, theobromine, and caffeine. The mechanism of action of these methylxanthine drugs, in the high concentration, it inhibits the phosphodiesterase enzymes, thereby increasing the concentration of your intracellular compound. Okay? Your cyclic AMP would result to the stimulation of the cardiac function, the relaxation of your smooth muscles, and even the reduction in the immune and inflammatory activity of specific cells. Okay? Mechanism of action also of their methylxanthine drugs, they inhibit the cell surface receptors for adenosine and in the enhancement of your histone deacetylation. Okay? For the pharmacodynamics, they can cause mild cortical arousal with increased alertness and deferral of fatigue, especially the caffeine. Pag nagiinom kayo ng kape, na ano nyo, yung parang bumibilis yung pagtibok ng puso, sometimes even for mga naka 5 to 6 cups na kayo ng coffee a day, nagkakos ng arrhythmias. Okay? They can cause also decreased blood viscosity, especially for pentoxifylline. Okay? They stimulate the secretion of gastric acid and digestive enzymes. Okay? They are weak diuretics, kaya pag kape kayo ng kape, parang ihi din kayo ng ihi. And then they improve the ventilatory response to hypoxia and to diminish dyspnea. Okay? For the antimuscarinic agents, the mechanism of action of your antimuscarinic agents that are used in asthma is they competitively inhibit the action of your acetylcholine at the muscarinic receptors. And the most common na ginagamit as the antimuscarinic agent is your atropine. Okay? They are bronchodilator. They can cross the blood-brain barrier, and they are potent competitive inhibitor of your acetylcholine, the postganglionic muscarinic receptors. Okay? Your ipratropium is also a potent atropine analog. That's why pag binibigyan nyo yung, or ninenebulize nyo yung asthmatic patients with ipratropium in combination with salbutamol, nagko-complain sila ng tachycardia or the faster heart rate. Okay? Because of the anticholinergic effect. We have also corticosteroids as an asthmatic drug. The mechanism of action of your corticosteroids, they inhibit the production of your inflammatory cytokines. Okay? They do not relax the airway smooth muscles directly, but they reduce the bronchial hyperactivity and reduce the frequency of asthmatic exacerbations. Okay? It can, upon administering corticosteroids, they result in the contraction of engorged vessels in the bronchial mucus and in the potentiation of the effects of your beta receptor agonists. Okay, your corticosteroids like yung hydrocortisons, it results in inhibition of the infiltration of asthmatic airways by lymphocytes, eosinophils, and mast cells para mag-decrease yung inflammation in the bronchial area and para ma-relieve yung asthmatic episodes. Okay? They can be given, corticosteroids can be given as prednisone at 30 to 60 milligrams per day in an oral form. We have also the methylprednisolone at a dose of 0.5 to 1 milligram per kilogram, Q6 or Q12 hours intravenously, or they can be administered by inhalational. Okay, we have the beclomethasone, budesonide, cyclosinide, flunisolide, fluticasone, mometasone, and triamcinolone. Ang common na ginagamit namin dito is yung fluticasone. Okay? We have also the leukotriene pathways inhibitors for the treatment of asthma. We have the silutine, which causes the inhibition of your 5-lipooxygenase, thereby preventing the leukotriene synthesis. We have the saferlucas and the montelukas, yan, common na ginagamit. And the mechanism of action is by the inhibition of the binding of the leukotrienes D4 to its receptors on the target tissues, thereby preventing its actions in the asthma stimulations. Okay, so these are the summary of the anti-asthmatic drugs. We have the beta agonists, we have the albuterol, salmeterol. They are selective V2 agonists, beta 2 agonists. Okay. We have also the epinephrine, which is a non-selective alpha and beta agonist. And we have also the isoproterenol, which is a beta 1, beta 2 agonist. Okay. We have also the inhaled corticosteroids. We have the fluticasone, even the beclomethasone, budesonides. They are also used in asthma. It reduces mediators of inflammation, and they are used as a prophylaxis for exacerbation of asthma. We have also for systemic corticosteroids, the oral form of prednisone, which is given at the we have also the methylprednisolone. And we have also the stabilizers of mast cells and other cells. We have the promoline, but it's not no longer available even in the US. For the mechanism of action, they alter the function of the delayed chloride channels and also inhibition of inflammatory cell activation. Okay. We have also the methylxanthines, so the theophylline, which is the mechanism of action is phosphodiesterase inhibition and adenosine receptor antagonist. They can be given for both for asthma and COPD. We have also the leukotriene antagonist, the montelukast, the sofralucas. Um, they block the leukotriene D4 receptors. And the immunoglobulin E antibody, which is the omalizumab, these are humanized immunoglobulin E antibody that reduces the circulating immunoglobulin E, okay, for the reduction of the frequency of asthma exacerbation. Okay. We have also the anti-interleukin 5 pathway antibodies. We have the mepolizumab and the dupilumab. Okay. They are your mobilizumab. These are humanized anti-interleukin 5 antibody that reduces the circulating and tissue eosinophils para it reduce the frequency of asthmatic exacerbation. Okay?